Hello, my name's Allison Crabtree, and I'm a certified registered nurse practitioner specializing in family practice. I'm also a nurse educator. Today, I want to share an evidence-based practice strategy that has the potential to positively impact patient care and address a growing health concern related to the use or misuse of some of the most commonly prescribed medications. This proposed quality improvement project will be implemented in an outpatient clinic I'm very familiar with, and one in which 4 advanced practice nurses, including myself, assess and treat patients with a variety of common health concerns. The emergence of antibiotic-resistant bacteria is a serious threat to patient safety and growing health concern. These bacteria have been directly linked to the use or misuse of antibiotic medications. Antibiotics are some of the most commonly prescribed medications. These medications are generated in large numbers in outpatient healthcare settings. Almost half of all antibiotics prescribed in the U.S. are generated in primary care clinics. Unfortunately, leading research finds that as many as half of these prescriptions were written unnecessarily to treat common conditions that are unresponsive to antibiotic therapy. Increasing awareness of these findings through provider and patient education, combined with the development and implementation of antibiotic stewardship programs, is critical to decreasing patient safety risk related to inappropriate prescribing practices. By targeting education to individual prescribers and tailoring stewardship programs to the needs of an organization, providers can evaluate their own prescribing habits and have input into activities that support antibiotic stewardship in their own practice settings. The purpose of this video is to introduce a proposed tailored educational program directed toward advanced practice nurses practicing in an outpatient setting. This educational program, combined with a recommended new practice protocol, provides structure for a future antibiotic stewardship program tailored for this outpatient primary care setting. The recommended practice change, a delayed antibiotic prescribing protocol, directly addresses the call to decrease risk to patient safety related to antibiotic use or misuse. My organization seeks to deliver the right care right here. As a rural nonprofit regional medical center, we recognize that what matters most is our patient. As a leading healthcare organization serving the local 5-county region, we pledge to treat each patient like family. That means we have an unwavering commitment to delivering high-quality care, and we do this with integrity. Most importantly, we deliver this care with each individual patient in mind. We tailor this care and strive to keep the patient at the heart of all we do. Our mission is to deliver high-quality, patient-centered care with integrity. We accomplish this by adhering to best practice standards. As an organization, we rely on research findings and the latest evidence to develop policies, procedures, and protocols that direct patient care. By aligning this evidence with practice, we expect and realize improved outcomes. When we base patient care on evidence, we can confidently rest in knowing we're delivering the highest quality care. This care is patient-centered and meets the needs of our patients and our organization. We realize that the healthcare industry must adapt to change, and we continuously seek ways to improve the care we deliver. The new practice recommendation that I share with you today was born out of the commitment of our organization to look to research, evaluate the findings, and adapt the way we deliver care to give our patients the highest quality care possible. Implementing this practice change should be very cost-effective. The Center for Disease Control has developed educational resources that can be used by outpatient clinics seeking to develop and implement antibiotic stewardship programs. These resources are provided to organizations at no cost. The CDC offers many print resources designed specifically for patient education and handouts. Reproducing this material is very cost-effective for our organization. Developing an educational program for the target audience, while time-consuming, requires little budgetary resources. There will be space needs to conduct the educational program, but there are several options for classroom space located conveniently nearby. The self-report procedure of providers will not impact the clinic budget, nor will the policy development. While hospitals have historically been able to electronically track and trend data related to antibiotic prescribing, cost, and complications, this is very challenging in the outpatient setting. What we do know is that the cost of not implementing stewardship programs is very high. As a result of antibiotic use or misuse, as many as 2 million individuals are infected with antibiotic-resistant organisms, resulting in approximately 23,000 deaths annually, according to the CDC. According to the Combined Infectious Disease Society of America and the Society for Healthcare Epidemiology of America guidelines, developing antibiotic stewardship programs have the potential to become financially self-supporting. Some programs have resulted in 22 to 36% decreases in antimicrobial pharmacy use, which correlated to $200,000 to $900,000 in savings annually. While these savings are specific to inpatient settings, it is expected that outpatient clinics that have properly implemented antibiotic stewardship programs have the potential to affect not only patients but healthcare systems at large. In many organizations, these types of programs result in savings that are often used to support additional staff to manage their stewardship efforts. Transformational leadership acts as a catalyst for sustained practice change. In organizations like ours, employing transformative leadership traits can result in leaders and followers learning to work alongside one another, working together as partners to facilitate growth, translating evidence into practice, utilizing critical reflection and communication, employing team-based problem-solving results in collective decision-making. Team members work together in partnerships where each member is empowered and grows as the organization changes. Communication is key in garnering buy-in and sustaining practice change. The educational course will be designed to meet the unique needs of the adult learner and answer the common question among adult learners: how do I apply this new knowledge to how I currently practice? Good communication is essential to combat anticipated resistance from patients. Many lay people are simply unaware of the risk of taking antibiotics unnecessarily. By increasing awareness and educating our patients, staff can significantly quell patient concerns. Education will be delivered verbally and reinforced with print material. Staff and providers will receive training through a focused educational course. This course meets the requirements for continued educational credit and will be timed to correspond with traditionally scheduled quarterly meetings. These quarterly meetings are generally held early mornings before the clinic opens, which allows all staff to participate with no interruption to the clinic flow. Course participants will have increased knowledge specific to the appropriate use of antibiotic medications after the educational offering. This increase will be measured using a pre-test, post-test design study. Additional topics covered will be adverse events related to antibiotic therapy and strategies for patient education. Staff and providers will learn methods for dealing with anticipated patient resistance related to delayed prescribing, if indicated. A new recommended practice protocol will be introduced during the educational course. This evidence-based practice has been proven to decrease unnecessary antibiotic prescribing. To support this practice change, a new policy has been developed and will be implemented as part of this QI project. The policy provides guidelines to advanced practice nurses for appropriate antibiotic prescribing. The objective of the policy is to decrease unnecessary antibiotic prescribing, to increase the knowledge of patients and providers, and to decrease the safety risk to patients related to the use or misuse of antibiotic medications. The policy defines the responsibilities of support staff nurses and the advanced practice nurses, and clearly outlines resources that support evidence-based practice. After the educational course and ample time to review the new policy, providers will collectively determine a start date for the new protocol. Self-report of advanced practice nurses has been determined to be the most efficient, cost-effective method of evaluating compliance with the new policy. In the absence of a dedicated, highly skilled staff member, any alternative methods of evaluation would be cost prohibitive and threaten the successful implementation of this QI project. Tracking and evaluating the progress of the QI project will largely rely on self-report mechanisms. The change in knowledge after the educational course will be assessed using a pretest and post-test survey. Change in practice behavior will be measured using the advanced practice nurses' self-reported data. Though not a part of the initial QI project, a measure of patient knowledge could be a potential area of future research. The current use of paper charting makes it impossible to electronically track prescribing habits. However, if in the future a fully functional electronic medical record is implemented, tracking prescribing trends electronically could be undertaken. The cost of implementing an electronic medical record would be cost prohibitive at this time. A future goal of the organization is to implement a mechanism for tracking trends electronically. Thank you for allowing me to share this compelling research with you. I hope you'll be inspired to consider the impact of antibiotic use or misuse on those you care for, and even on your own personal health. Together, as a healthcare system made up of providers and patients, we can make a difference in the growing concern of antibiotic-resistant organisms and collectively promote the safe use of antibiotic medications.